Hello, friends and neighbors. I'm Kate Lester. I am your friendly local epidemiologist, medical geographer, and it's the Saturday before Thanksgiving, and I think it's time for an update on the situation with COVID-19 in Denton County. So I was on Keeley-Briggs Forum this week, and I appreciate the opportunity to talk to the community in that venue. But there's a lot more information, right, that I wasn't able to share. So let's get into it. Okay, there's a lot going on. Okay, so if you're still unfamiliar with who I am Kate Lester. I have a master's degree in medical geography, and I am currently writing my dissertation for my PhD at UNT. But of course, yeah, my views do not reflect those of UNT's necessarily. So the first thing that you're probably aware of is that the new case count has been going up extremely rapidly over the past month or so. So yesterday, Friday, November 20th, we hit a record of 405 new cases announced that day. We've rarely gone above 300. So things are changing rapidly. What this graph is showing is a 7-day rolling average. So that high at the end there, that's not a spike like a 1-day number dump spike. That's the average of the last 7 days. So yeah, it's a concern. So this is what our pandemic has looked like so far in Denton County. That little bit there that we can barely see now is the first wave. That's when we had our shutdowns. That is when New York was really struggling. This middle chunk here, that's our summer wave. That's the second wave. And we kind of came out of that in early September, just in time to start building up this third wave here that we are definitely 100% in. On October 13th, we started getting both PCR, which is the viral test. Usually it's up your nose, but not always, and the antigen rapid test results. So prior to that, we were only getting PCR tests. That's why we have a red line and a blue line now, okay? So all of these are real. They are real. False negatives or false positives are very rare. False negatives may be common. So especially with antigen tests, the positive rate is probably higher than what we're seeing. Similarly, we've seen almost a doubling in active cases over the past 30 days. So this is number of cases that have not been resolved yet by the county, either through case tracking, where they can mark you recovered, or death, unfortunately. They have already said that they are starting to get behind because they just don't have enough people to process how many cases we have. And there's been no word about hiring more people to get through this wave. Sorry. I just wanted to show you that it's not just us. This is echoing what's going on in Texas. Again, this is this second wave here in the middle, and now we're well into the third wave, where we're on average more than 10,000 new cases in Texas a day. So don't think that if you are leaving Denton to go somewhere else in Texas that it's better. It's not. This is happening all around us as well. So really quick, let's just touch on who's getting sick right now. And this is the past 3 months by age, okay? What you can see is every single age group is going up, but the one that really stands out is teenagers. So they were one of the lowest groups up until September. So it really does seem like it has to be somehow related to school, whether they're getting it in school or it's school-related activities, or this is just let their guard down, parents let their guard down. I'm not sure. But at this point, teenagers have the highest rate of new infections in the county. So they're beating even the 20-year-olds who we were blaming for the summer. And that increase has been extremely rapid. So if you have a kid that's 11 or under, it's increasing, but not at a huge rate. But if you have a kid that's 12 to 18, 19, that's a big concern. And part of the problem is that teenagers react to the virus a lot more like adults than the kids, okay? So we have had 22 teenagers die in Texas so far from COVID-19. So work with your high schoolers, right? Now, everybody else, you also need to check yourself because everybody's increasing and almost everybody's, well, over in 70s, they've more than doubled in the past 3 months. So it's everybody, but particularly young people and teenagers, really be careful. And then we have the highest rates among Hispanic residents in Denton County. However, what's really interesting is that the Hispanic residents are not responsible for this new surge, okay? Their rates have been high the whole time, and there's a whole slew of literature about that. We can talk about that some other time about what's going on there. What we need to say, though, is that everybody else is powering this, right? So white people particularly, their rate has increased faster than everybody else's over the past 3 months. So check yourself. But my Black neighbors, my Asian neighbors, and my American Indian Alaska Native neighbors, everybody watch out, okay? Because the numbers are going up. Now, when we talk about flattening the curve, right, there are so many curves in COVID statistics that it's hard to even remember what we were even talking about. What we were talking about was hospitalizations, because what we really don't want is for our hospitals to get overwhelmed and basically not have the space to care for our residents. That is when things really get out of control. That's when deaths skyrocket because you can't get treatment, right? It doesn't matter if we have a new treatment if you can't get in the door. So we are setting records on hospitalizations as well. Yesterday, we had 125 people with confirmed COVID in the hospital. That is the highest it's ever been in Denton County. As you can see, the trend line is now well above where we were in the summer, which is a concern. It's a big concern, and I know that our nurses and doctors are really worried about it. They're burnt out, and this could become a bigger problem than it is right now. Okay, so we're not out of space, but we're getting there. Okay, so in the past 30 days, the available beds in the ICU has dropped on average by half. So in mid-October, we had between 30 and 40 beds in Denton available, and now we've got between 10 and 20. So that's not a good trend. You don't want to be running out of ICU. Now, out of the 125 people in the hospital with COVID, only about 25 to 30 this week on a daily basis have been in the ICU. So that's good. But what that also means is that almost half of the people in the ICU in Denton County are there for COVID, which is a pretty disturbing statistic, I think, right? That half of our critical care people or patients have COVID. Now, there was a question that Keely sent me and we didn't get to, and it's one of the things, you know, that drives me crazy. And that is that this complicated timeline that COVID's on. And I understand that it's very difficult to keep it straight. So I'm going to keep coming back to it because it's really, really important. So here's a timeline based on prior data, both from our summer wave and from the literature generally, from the medical experts, right? So we should be pretty familiar with the idea that you have between 2 days and 2 weeks between catching the virus and then having symptom onset, okay? So you start feeling sick well after you catch the virus. The average is 5 days. And for the last 2 days that you are pre-symptomatic, that is when you are at most risk of infecting other people because you have a high viral load, but you feel okay. And you don't know that you're sick, so you don't avoid people and you don't stay in bed. So that's what we're most worried about as far as you infecting other people. And then you go into the symptom onset period and you are sick. All right, so you're just feeling crappy. Now, what's important here is that currently there is a 14-day lag between symptom onset and when we, the public, hear about this case. Okay, so it's 2 weeks between when someone's most infectious and when we find out about that case. It's almost 3 weeks between when someone catches the disease and when it's announced to the public. Okay? So when we see these cases come out yesterday, 405 new cases announced, those people on average started feeling sick 2 weeks ago, okay, in early November. On average, they were exposed around Halloween or even earlier. So when you see those numbers, resist thinking that that is reflective of the environment today. It's not. It's historical. And we don't know how bad it is today. Okay? Now, generally speaking, you see hospitalizations peak 18 days after symptom onset peak. That's what we saw in the summer. So there is a big lag, more than 2-week lag between people starting to feel sick and people ending up in the hospital. And then there's another 10-day lag between when the deaths start. Hey. So here's what exposure looks like right now, based on the symptom onset data that we have from the public health department, which is so great that we have that. Most places do not keep that information or give it out to the public. With the symptom onset data, we can build a model of when people caught COVID. And that's like the number one question that you get if you're in kind of my situation, where it's, well, what conditions led to where we're at? Or are we more likely to catch it now than we were before, right? So what this graph is, each slice is, hold on. Oh. Okay. Oh, shit. All right. So what this model is, each slice is cases that were added in a certain week. So this darkest blue slice is the cases that were added in the past 7 days and when they were likely to have gotten ill. So the peak currently is right before Halloween. And then you're moving back, right? So you can actually see this cresting like a wave. Now, here's what we don't know. We don't know what happens after the peak because it's got this long lag on exposure, right? So it could be that this peak is much higher than we think it is now. That's what happened in the summer, that this peak just kept growing and growing and growing and growing over the course of a month because the test lag kept growing. It could be that it's growing, but it's moving, right? So that this isn't the height of exposure. The height of exposure is much more recent. It could be that exposure has actually decreased. Maybe people have been behaving differently and we'll see that. But it will take several weeks for us to see that, okay? Again, we really can't assume that we know more than maybe a month in the past what was going on. Okay, that's about as much confidence as I have in the data, just because the way the timeline is. So what led to our current situation? This is so weird. Anyway, the curve started to bend right around university move-in. Now, I'm not particularly blaming any one incident for this, because it isn't. It's not one event or two events. It's lots and lots of things. But I want to give us an idea of our history, because I think our sense of time is altered right now. So UNT move-in mid-August. Mid-August is about when it started to bend. Okay, so we were bringing things down from that summer curve, and now it's going back up again. There's Labor Day. At Labor Day, that's about when DISD went back to school and had in-person school, and for a couple of weeks, it was growing, but at a relatively slow rate. Now, on September 19th, Greg Abbott pushed forward a new reopening. And so now restaurants, retail, offices are at 75% capacity. They reinstated elective surgeries, and they started allowing nursing home visits with a lot of strings attached. At that point, the rate of exposure started increasing dramatically. Okay. That does seem to have changed the situation. And I don't know if it's because of that 75% capacity or because it sent the message that green light, go ahead, go out, right? I don't know what's happening there, but it was important. Now, on October 13th, Dallas issues a red threat COVID warning. They had gone down to yellow or orange. I don't remember exactly what their system is, but they put it back up at the highest warning level. They said something's coming, this looks bad. The next day, Greg Abbott opened all the bars, or said the bars could open. Here in Denton County, Andy Eads signed off on that. This is right about the time he got COVID as well. And so our bars have been open. And as you can see, we don't have much information about what that's done yet. It hasn't gone down. Or the week after that, right? I mean, part of me was hoping that when Donald Trump got sick, people would change their behavior. And that doesn't seem to have happened, right? That was early October. And so I'm not sure what it would take. But yeah, actions have consequences. And so over the next couple of weeks, we'll get a better idea of if the bars reopening had any kind of effect on making the speed up even more. I don't know about that. So another thing that's going to determine our timeline, right, is this lag time between symptom onset and case announcement. And so during that time, a person has to decide to get tested. They have to go get tested. The lab has to process the test. The lab has to report it back to the public health people. The public health people have to contact the person who took the sick person, right? And then they can announce it to us. That's what this time is. And so if things go wrong on any one of those steps, then you can get huge lags. So the green bars, which is where we are now, we're at the very top of the green bars, indicate that it's taking 1 to 2 weeks between symptom onset and case announcement. Currently, we're right at 14 days, okay? So we're about to go into the yellow bars, which is 2 to 3 weeks. Now, in August and September, because they were dumping a whole bunch of ancient cases on us, the lag went up to like 6-7 weeks. It was awful. We couldn't tell at all what we were doing or where we were in the pandemic until that worked its way out. So while the lag is growing slowly, we're keeping it somewhat manageable, I suppose. And that's what we really need. If we start seeing this number go up, then basically we cannot say that we have much confidence in surveillance, okay? And we'll have to be even more careful because we'll be blind. Now, here's the last thing I want to talk about is deaths, because people always want to talk about deaths. They always want to ask, well, if the cases are up and the deaths aren't up, then everything's fine, right? First of all, no, it's not fine. It's not fine to be in the hospital. It's not fine. But deaths lag at least a month behind exposure. And in Denton County, if you're waiting for the county to announce it, it could be 2 months, because they do extra investigation above and beyond even the doctor that turns in the death certificate. So do not wait for deaths. If you wait for deaths, you're going to be like so far behind, you will have no idea what's going on. So currently, depending on if you ask the county or the state, we have either 146 or 199 deaths in Denton County so far, okay, from COVID-19. The difference is that the state just records the death certificates that doctors have certified. The county does extra investigation, and so far I can't really tell if they are eliminating cases or if it's just taking a lot longer for them to report them. I really don't know. But you should know that the way the county is doing it is the way we pretty much do epidemiology in the United States of America. I don't know what the county's doing. The state, that's the way it's done. We've had about 45 in the city of Denton, but that number is higher given the population, just because we have a whole lot of nursing homes in the city. Based on historical data, if we compare the same time period to 2018, COVID-19 is the third leading cause of death in Denton County. Okay, behind heart disease and cancer. So I know sometimes people can look at those numbers and think 200 people is not that many, which, I mean, if you see a group of 200 people, it's a large group of people. But that is the third leading cause of death. And infectious diseases rarely make the top 10. Rarely. Okay. So this is very strange. This is outside of norm. And we can do something about it. We don't have to just sit back and say, yes, we can let it kill a bunch of people. The average age of death in Denton County is about 73. We haven't had anybody under 40 die. However, once you get above 40, we have deaths in every age group. Okay. 60% of the deaths are male. That seems to be pretty standard across the country. For whatever reason, COVID is more deadly for men than for women. And 40% of the deaths in Denton County are institutionalized. That means they're in a nursing home or an independent living center or something like that. Okay. Jail, even. So here's what the curve looks like for cumulative mortality. The red curve is the Texas state data. What's special about that data is that it is organized by date of death. The blue line is the county data, and we only have date of death announcement. And like I said, it can take them 2 months. It can take them a very long time to announce a death from the county. So take it with a grain of salt. I tend to prefer the state line because I trust our doctors. I've been trained that we trust our doctors in public health. I don't know, maybe that's crazy. So what you can see is in the summer, starting in late June, early July, you had a quick upturn in deaths, right? So that's the summer wave, that steep up. We managed to bend the curve, not really flatten it, but we bent it by early September. But there's some evidence that, okay, it's starting to get steeper again now, right? And because you can go back and add deaths that died, in early October, late September, if the investigation says that, yeah, that's what's going on, that line can change, okay? So if we look at Texas, it's a lot more dramatic, because with Texas, we have larger numbers. We can do new deaths per day. With Texas, we've been adding a lot of deaths. We started adding them in late October, but if we look at the death date, they started accumulating. The change started in early October. Now, we know that El Paso is kind of the epicenter of the third wave so far. And so a lot of this is coming out of El Paso. But I want to show you that, yes, deaths are increasing, deaths are up, and it's happening, and it's coming, and it is just on a lag. All right? So don't come for me and tell me that, oh, well, it's fine, no one's dying. They are, and they will. So with all of this, it's not good news. But the thing is, the only way this can change is if we change it, because our governor has made it very clear he's not going to do anything. So we need to be the change. We need to be the ones that step up for our community members. So, yep, next week is Thanksgiving, and I really, really, really don't want you to travel, and I really don't want you to get into a big group. Please don't do this. Please don't do this. Please understand that even if you think that you have immunity, what are you doing? You're showing everybody who's being safe, doing the right thing, that they're, what? I mean, come on, just have solidarity with your neighbors for once. So there's a lot of things you can do, okay? You obviously can do Zoom giving. There's a lot of conversation about that. You call people, you talk to them, right? I mean, for most of the people you see on Thanksgiving, talking to them for 10 minutes, probably fine, right? Front yard visits, okay? You can yell at grandma through the window, right? You can meet outside, you can say hi, but you're not going to sit down in an enclosed room and do this. You can do share a plate, okay? You have a couple of people in town who you would have Thanksgiving with. Tupperware, drop these things, and you could all have the same meal, just in different places. The CDC is saying it's probably not really contact spread. It's almost always respiratory spread at this point. So don't worry about that as much as being in vicinity with somebody else. Lots of local restaurants are doing takeaway Thanksgiving plates because lots of people are spending Thanksgiving alone or in small groups, okay? So it's also an opportunity to support local business as well as, you know, your neighborhood health. There's always volunteering and community service. I'm sure there's all kinds of opportunities to do that. This is a thing that lots of us do on Thanksgiving normally. And to that end, a friend and I has started a group on Facebook that's Won't You Be Our Neighbor? And we are trying to bring the holidays, a little bit of festivity to people who are doing the right thing, who are in quarantine, who are working from home, and how do we create a community when we can't be together, right? So until Wednesday, we have a drive for hand turkeys with greetings for people living in the nursing homes, assisted living homes around here. The drop-off is at Golden Boy Coffee. We'll be picking it up till Wednesday afternoon. So if you want to leave cards or messages for those people, I'm sure it would be appreciated. They're going to have to eat Thanksgiving dinner completely alone in their room because of the situation. We are also organizing a Thanksgiving Day car parade to go to some of these places, and there should be information coming soon, both in our group and in the Denton Record Chronicle about that. So if you want to join that, just get out of the house, throw the kids in the car. Let's do it, right? And moving forward, we're going to be collecting decorations, cards for the nursing homes, Christmas, Hanukkah, Kwanzaa, winter, solstice, New Year's, anything. Whatever you celebrate, we want to celebrate it with you. So there are lots of things you can do that are different. And I really encourage you to not frame this as something painful, but something that we need, something that's community service. It's patriotic. I don't know of a single philosophical or religious tradition that encourages you to do whatever you want if it means that the most vulnerable people in your community will die. I don't. And I don't know how that radical position has been ingrained in our society over the past 8 months. Thanksgiving is a holiday about coming together as a nation during crisis. We didn't have a Thanksgiving nationally until the Civil War, okay? And we need it because if these trends keep going, Christmas is going to be horrible. And you can stop it, and I can stop it, and the people that you love can stop it just by inconveniencing ourselves just a little bit, okay? And then we're going to all be together again, hopefully next year. So, yeah, I really hope you'll think about this. I really do. We need you. We need you to step up. We need you to not gather in groups. We need you to stop going to football games. We need you to stop going to the bar. We need you to stop eating in restaurants. If you have to go to the store, send one person from a household, make a list, be in and out. If we do this for a couple of weeks, we can save so many lives. It's really not a big deal, you guys. It really isn't. I don't know how else to appeal to your better nature. If you are at home, if you are staying put, if you are doing everything you can, thank you so much. I thank you so much for listening to science and listening to our community's medical staff who are bedraggled and exhausted. Thank you. Wear your quarantine haircuts with pride because you are the heroes of this, along with, obviously our doctors, our first responders. So I will keep you updated as things hopefully get better. But either way, I'll be with you over at COVID by Numbers. So I hope you have a great Thanksgiving, no matter what you do.